IMT's Hadron FPLS system is the first and only foam pad lift system developed for the Trendelenburg surgical position. Our pad facilitates a safer, more ergonomic method for patient moving practices than would otherwise be possible with current pads or techniques, benefiting both patients and providers. Allow us to demonstrate the optimal method for employing the Hadron FPLS system to evolve your standard of care. Step 1. Make sure to remove any sheets or overlays from the surgical tabletop and make sure that it is free of moisture. The pad system goes directly on the mattress top. Step 2. Take the Hadron FPLS out of its wrapper and peel off the 6 PSA strip tabs on the underside of the pad. This exposes IMT's innovative repositionable pressure-sensitive adhesive. If used for lithotomy procedures, please pull the foam backer system out to expose 2 inches at the top of the pad, as this allows the lower portion of the pad to fold under should the patient's perineal area not be placed far enough at the bottom of the pad needed for surgical exposure. Step 3. Flip and place the pad on tabletop, foam side up, pressing the pad down all along the edges to activate the adhesive. Position the pad close to the head of the table to facilitate optimal anesthesia airway access needed for laryngoscopy. Step 4. If using the lift sheet to secure the patient's arms, you may now place it on top of the pad at this time, before the patient is loaded. IMT's Ion ESPS arm induction system works in synergy with the Hadron FPLS system to ensure optimal patient safety throughout the course of the procedure by greatly improving the pad-to-skin contact needed for maximum traction. Pads are not as effective if 40 to 80% of the surface area is covered with a sheet, which usually contributes to patient sliding during gravity-dependent positions. Step 5. Once the patient arrives and before they move to the table, reposition the pad as necessary to line up with the patient's torso so the patient's head is proximal to the anesthesia provider. If necessary, reapply pressure to activate PSA, especially on thinner patients. You may wish to use the Hadron's Velcro strap to secure the pad to the bed rail on the patient loading side to minimize any chance of the pad flipping up as the patient moves onto the surgical table. Step 6. Make sure the patient's perineal area is placed at or slightly over the lower edge of the pad, as this facilitates movement and favorable positioning during lithotomy. You can tear out the perforated perineal portion of the pad if necessary. You may also fold under any unexposed blue lifting pad material as explained in Step 2. Step 7. After the patient has been intubated for general anesthesia, 2 to 4 providers may then use the handles to lift and move patients to correct position as indicated for lithotomy. It is necessary for a provider to lift and hold the feet while the patient is moved in order to maximize ergonomic safety and to keep the pad straight. Once the pad is positioned, we suggest using the Hadron's 2-inch Velcro straps to tether the system onto the bed rail system. Step 8. If using the Ion ESPS arm induction systems, arms may be secured as indicated. If the standard sheet is used for securing arms, please follow current AORN standards. Step 9. Place the chest pad in the center of the patient's chest and then apply the 2-inch Velcro strap to the bed rail system in order to secure the patient. Tighten as needed using clinical judgment to minimize pressure-related injuries. This is an important step in minimizing any potential for patient sliding and significant degrees of Trendelenburg. The chest strap must be used with this pad system as it assures PSA compression and decreased movements related to skin elasticity, especially in moderate to obese patients. The combination of the Ion and Hadron systems maximize most, if not all, variables needed for maximum traction and safety. Step 10. Always perform a max Trendelenburg test with the patient and readjust as needed. Thank you for your time in learning how Infinitus Medical Technologies can evolve your standard of care. Please visit us at infinitusmedical.com to request additional information or to schedule a demo. We look forward to hearing from you soon.